Mr. Dance, according to your previous video on YouTube, you talked about PrEP and PrEP. So, I wanted you to tell us what is PrEP and PrEP.
Okay. Last time we said PrEP is where one uses ARVs before exposure to HIV infection. Before you get exposed, before you get pricked, before you have unprotected sex, you want to use ARVs as a way of preventing HIV infection. Whereas we said PrEP, that is post exposure prophylaxis. We said you already exposed, you've pricked yourself, you've had unprotected sex, one has been raped, so you're using ARVs to prevent infection when you are already exposed.
Okay. Then another thing, how do you know that someone needs PrEP? Like, how do you know someone is over risk HIV?
How you know is there's what we call screening for risk of HIV exposure. When you look at the medical guidelines of the different countries, we have a number of things we look at. So the screening for risk of HIV exposure, it will range from people living in a discordant sexual relationship. You have a man and a woman, one is HIV positive, the other is not aware or is aware. Then you have people who have had unprotected vaginal sexual intercourse with more than one partner of unknown HIV status in the past 6 months. That person is at risk. Then you're having people who have had anal sexual intercourse in the past 6 months. Those people are at risk. That is how we are saying you get exposed. What you're doing makes you more exposed to getting HIV. Then we are saying also people who have had sexual intercourse in exchange for money, goods, or services. Yes, it might not be necessarily sexual workers, but I don't want to describe it that way. So people who have had sexual intercourse in exchange for money, goods, or services in the last 6 months, you are at risk of HIV infection. Then we are having someone who is having STI, that is sexually transmitted infection, that he has had more than one episode in a year or within the last one year or 12 months. That person is at risk of getting HIV infection. Their exposure is more than someone who has not. Then we are saying someone who is a part of a discordant couple, especially if the HIV positive partner is not on ART or is not on ARV or has been on ART but for less than 6 months, or they have been on ART and their viral load is not suppressed. Such a person is also at risk of exposure to HIV. Then someone who is having who has had recurrent use of PrEP, that you're always being exposed and you end up using the HIV drug to prevent the infection. For example, doctors who work in the labor suit, they are always exposed. They always get needle prick in the process of repairing repairing tears of our mothers. So people who are having recurrent PrEP use, that is to say 3 times, I mean more than 3 times in 1 year, you are at risk of HIV infection. Then we are saying members members of key or priority population who are unable or unwilling to achieve consistent use of condoms. We have men who do not want to use condoms. They do not like, even women who do not like to use condoms. They assure you they can't, they don't like it. So such population, it is better you get screened for HIV exposure risk, because you're at risk. That is how we know that you are at risk of HIV exposure and infection. Maybe you have another question.
Okay, another question. How do you screen for eligibility for PrEP after knowing one is at risk at HIV exposure?
So once we have done the screening for risk exposure, how we know that you are eligible, because you being exposed to HIV infection does not guarantee you to take PrEP. So what we do is we do a number of screening to see whether you're eligible for PrEP. Number one, we should know that it is likely to be more prevalent in the population such as the discordant couple, the sex workers, the fisher folk, the long distance truck drivers. We saw what happened during COVID-19, like the case of Uganda, what the truck drivers were doing to the women. So we are also looking at men who have sex with men. We are looking at uninformed forces. We are looking at adolescents and young women, including pregnant and lactating mothers. Uh, those ones are at sustained risk. So what do? We should know that we screen for eligibility if the person meets the substantial risks for HIV exposure criteria, as I explained before. Yes. So what we do is, number one, we should confirm that you're HIV negative, because it is already ARV, and yet the ARV drug regimen that people with HIV take is different from this one. The regimen is not the same. So that's why we want to confirm that you are not HIV positive. So number one, we confirm that you're HIV negative. And how we do it, there are two ways. One, you can do the blood-based self-testing, maybe using the start pack from clinic or home. Then number two, the most important one is we have our national HIV testing algorithm. That is what we follow. Maybe in the next videos also I can show you how the national HIV testing algorithm works. Then number two, we must rule out signs and symptoms of acute HIV infection, because you may come for PrEP when you have actually had an exposure maybe 2 weeks ago, and now you're having an HIV infection and you're in the acute phase. So we have to rule out signs and symptoms of acute HIV infection before we enroll you, or before we say you are eligible to taking PrEP. Then number three is we assess for hepatitis B infection. Normally when you're HIV, when you are at risk, or when you're exposed to HIV, we don't want to start you on PrEP when we confirm that you have hepatitis B. Not that when you have hepatitis B, you're not allowed to take PrEP. The thing is, we want you to go through the screening for hepatitis B, such that we see whether you're having the active or the dormant. If you're having the active, you're on medicine. Yes, because we don't want to start you on PrEP, because we have seen that it is evident that when I start you on PrEP and then I abruptly stop you from the PrEP and you have hepatitis B, there is always a flare or a sudden rise up of your hepatitis B viral load. So we want to screen you for hepatitis B infection, and if you turn out to be positive, we can refer you for hepatitis B management or further testing. But we should note that a client having hepatitis B is not a contraindication for them to receive PrEP. We can give them, but the thing is, I'm saying we need to take precautions to avoid hepatitis B viral flares. Then number four, we have renal function test, because we have seen that these drugs affect our kidneys. So we want to do renal function test to see how the client's kidneys are functioning. What we majorly want is we want to test for creatinine and creatinine clearance using using glomerular filtration rate, and when it is less than 1.2 milligrams per deciliter, we don't start you on PrEP. But also, if we are unable to do such a test, and the client does not have clear signs of renal failure or kidney disease, we start. Yes. So what I'm saying is that this test should not be a stop for someone to be initiated on PrEP. If it is there, do it. If it is not there, you can start the PrEP. So if it is there, you can do it before starting the PrEP, and also after the PrEP, you can you can do it every 6 months. That is for the renal function test. Then that is how we screen for someone's eligibility for PrEP.
Okay, thank you. I think people understand that. Yeah, then another question maybe I can ask you. What are the steps for initiating one on PrEP, or it's just go by ARVs and take if you feel like you are at a risk?
No, it is not just you feeling you're at risk, then you go buy ARVs. If you are to be initiated on PrEP, as I've explained before, that we screen you for the risk, we see whether you're eligible. Then the steps taken is that one, your medical worker is going to assess for contraindication to the drugs that are in PrEP, because the drugs are combination. So they want to assess whether you have any contraindication for any of those elements in the regimen. Then they will provide you with condoms and educate you on how it is to be used.
Yes.
Then they can give you now the prescription. Right now we have about 4 prescriptions that we are using. Maybe we shall talk about them later. Then when you have been given the prescription, we'll give you a 1 month follow-up date. That because PrEP we normally want to give you for 28 days if it is sorry, that is PrEP.
Pep.
For the PrEP, if it is the daily pill, we want to keep seeing you after every 30 days. After every 30 days, that is 1 month follow-up date. Then what we do is we counsel you on the side effects of the drugs or the individual component of the regimen. Then also we initiate after your initial visit, we give you 2 monthly follow-up appointment. That is when I give you PrEP, I see you after a month. When you come after that month, then I can tell you come back after 2 months. Then after the 2 months, then I can begin seeing you quarterly, because we need to keep in contact. We are doing so because we want to know side effects. We want to know how the drug is treating you. Then we want to know if there's any complaint. Then we want to keep following up with your renal function. Then maybe the next is we perform HIV antibody test using the national algorithm, or even the blood-based self-testing. That is, we want to keep following up such that you don't be on the. We might have started treatment when you had contacted the infection.
Yeah.
Then also for women, we want to do pregnancy test. We want to be sure that you are not pregnant, such that if you're pregnant, we'll see what to do for you. Then what we want to do is we want to also review your understanding on the PrEP, and then we see if there are any barriers. Then we want to keep following up and see adherence. How are you taking the drugs daily? Then is your body able to tolerate with the drug? If there are any things we want to intervene. And then as you keep taking, we want to keep assessing your risk profile. Then when we find that you're no longer at risk, we advise you to stop them. I think that is it.
Okay. Thank you. I think people have understood that. Then another question maybe I can ask you.
Mm.
It is. So do we discontinue PrEP? How and when does one stop taking PrEP?
Okay, how we discontinue PrEP is not normally abruptly unless otherwise. But if we want to follow how we guide the discontinuation of PrEP is number one. If the patient has acquired HIV infection, we stop you from PrEP and then enroll you on the correct regimen for someone who has HIV. Then number two, if we are suspecting signs and symptoms of an acute HIV infection following recent exposure within like 4 weeks, that is a month, yes, we discontinue. Then number three, we are saying lifestyle changes that now result into lowering your risk. Once we assess that you have lowered risk or you're no longer at risk, then we can stop you. Then maybe the next is where the patient or the person, the client, is unable to tolerate the side effects of the ARVs for this particular regimen. We want to stop. And then where we are having chronic non-adherence, that you give the client takes today, tomorrow forgets, the other day takes. So if it has continued like that, with even besides counseling, we want to stop you on PrEP. Then some can be personal choice. Client tells you, I want to stop here.
Yeah.
You respect that. Then where we are seeing that the HIV negative person in the serodiscordant sexual relationship, if the HIV negative person in the relationship with someone who is HIV positive, and that someone with HIV positive has taken more than 6 months on their ARVs, and then they have achieved a sustained low viral load, we want to stop you from taking PrEP once the viral load of your partner is undetectable, because currently we are using a system that undetected viral load is non-transmissible. As long as your partner's viral load is undetected, that means you're taking the HIV positive person is taking their medicine so well. So we want to stop you from PrEP unless you insist. But also, as we stop you from taking PrEP, we want you to continue using condoms. Yes, I think that is all. Unless you have something else to ask.
Okay, maybe what I can ask you next is, what are the available options currently, and in fact it's right time to clarify on that 2 to 1 to 1.
I've clicked that question. So
Why?
the available PrEP options right now. In the previous video, I tried talking about them, but I think I only listed them. We said we have the PrEP ring. The PrEP ring is a round ring. It is round and white. And we said for it is a long-acting HIV preventative method, and it is made of silicone. It is some small rubber, and we said we insert it in the vagina where it stays there for a month.
Yeah.
Yes. So it is round, white, flexible silicone material and contains 25 milligrams of dapivirine. Dapivirine is an ARV, and we said we insert it in the vagina and it remains there for a month. And the ring is able to deliver the drug directly to the site of potential infection, which is the vagina, over the course of 1 month.
Yeah.
And then it has a low absorption to our system. Therefore, it makes it have less side effects, less systemic side effects. Then maybe the only side effects that it is having that are available is that UTI in about 15% of the users. That is very low. Then vaginal discharge as a side effect is in about 7% of the users, which is very low. Then vulvar itching is in about 6% of users, which is still very low. Then we have lower abdominal pain in also about 6% of the users, which is still very, very low. Yes. Then maybe the contraindication for this PrEP ring is something small. I'll show you how it looks. So the contraindication, number one, if the HIV test is positive, we don't give you.
Yeah.
Then number two, if there is a known HIV exposure in the past 72 hours, we don't give you. There you would benefit more from PrEP. You're exposed, so we would prefer to give you a post-exposure prophylaxis. Then where we are having signs of acute HIV infection and also potential exposure within the past 14 days, there you're contraindicated, we don't give you. Then we are saying inability to commit effectively to using the ring and to attend scheduled time. If we are saying you come after every month and you're failing to come consistently, we don't give you. Yes. Then where you're having allergy or hypersensitivity to either the dapivirine or even just the silicone itself, which is rare, there we also don't give you. Or even the product information that you will receive from wherever you bought it, depending on the company, we don't want to give you. That is number one, the PrEP ring. Number two, currently we are having the long-acting injectable drug, the CAB, which CAB, we said it is capital C, capital A, capital B, standing for cabotegravir. We said it is an injection that is given in the buttocks, and we give you after every 8 weeks, and its efficacy is 95% effective. Side effect is that it is safe, it is generally safe and well tolerated, and currently we don't have any safety concerns. Contraindication is only hypersensitivity. There is no serious contraindication. And this one here particularly, it is indicated for all HIV negative persons who are at high risk of HIV exposure. Yeah, that is the long-acting injectable cabotegravir. We give you every 8 weeks. Currently, it is available, but specifically in the buttocks as intramuscular. Then maybe you said that I should clarify about the 211 PrEP regimen. So that one falls under the pills now. So the pills, we have the daily pills, which currently our guidelines have all adopted. The daily pills are the daily pills, and the 211 event based or on demand pills is where we are confusing. That is where there's a lot of misinformation. First of all, let me start with the daily pills. With the daily pill regimen, we have two options available. We have the Truvada, that is FDA approved. Truvada is having TDF plus FTC, that is tenofovir 300 milligrams plus emtricitabine, which is 200 milligrams. Then we also have TDF and 3TC, that is tenofovir and lamivudine. Tenofovir remains at 300 milligrams, and lamivudine here is also 300 milligrams. All those two, they come as a single pill. So you as the client, you swallow each every day. If you make sure you're swallowing at almost the same time. If you swallow today at 6 a.m., let the time remain like that until you're no longer exposed to risk. That is for the daily pill. It is taken as a one pill or tablet daily until you're no longer at risk, as your doctors keep checking you. Then we go to the event based or the on demand pills. That is where we are confusing with our daily pill. Number one, it has the same regimen, the Truvada, which is having the TDF and FTC. But the problem is that the event-based or the on-demand pills are again two. We have the 211 regimen, or the 211 dose-based. Then we have the 27 dose-based. But we should note that it is only Truvada that is approved for this. The recent discovery is not yet approved. The thing is that even the Truvada is not yet FDA approved, but we have several research that has shown that this drug is so effective when used in that manner. How it is used is like this. The first dose recommendation is this, that if I'm going to have sex once, the reason why we are saying it is event based or on demand, that I'm going to have sex once and I want to prevent HIV. I don't know, maybe the other person's HIV status, or they could be infected. So what I do is like this. Anyone who is having an insertive or receptive anal sex, insertive and receptive. For the penis, whoever is putting is the insertive, then whoever is receiving is the receptive. So anyone who is having a receptive or insertive anal sex needs this 211. Then what we do is you take two pills between 2 to 24 hours before you have sex. Meaning you'll be knowing when you want to have sex. So if you know that you'll have sex maybe tomorrow, it is better you take it such that the time you take it today, such that you have about 24 hours, because it is safer when you take it close to 24 hours. But in case you fail, you can still take it up to 2 hours before sex. That's why we are saying you take two pills of the Truvada between 2 to 24 hours before sexual intercourse. Then when you do that, after having the sex, then you take one pill a day after, meaning 24 hours after you have had sex. Then another pill 24 hours after that second dose. A total of 4 pills that you take two before having sex. Then after having sex, take 24 hours and take a pill. Then take 24 hours and take a pill. That is the 211 dose. Then what we should know is that someone may have sex today. I mean, may take the two tablets, have sex, then tomorrow they want to have sex again. So what you do is like this: if I've taken the first two pills, you have had the sex, then tomorrow you want to have the sex. So each day you have sex, you keep taking a pill, but you make sure the timing is the same, 24 hours. So even if you have sex for the next 1 week, you make sure you keep taking a pill, a pill, a pill. Then the day you stop having sex, take 24 hours and take a pill. Another 24 hours, you take a pill. So after the last day of having sex, you continue with one tablet a day for another 2 days.
2 days.
Yes. So now that will combine all whether you're having sex once or you're having sex many
Many
times,
times.
but you're using the 2-1-1 regimen. So that is it. Then maybe this one where someone may say, last week I used it. Now this week again I want to have sex. So you don't start with two, where you start with one. One before the sex, then you continue with 1-1 after the sex.
Okay.
Yeah, that is the 2-1-1 dose. Then one other thing is that the event-based 2-1-1 dosing. If you will have sex over a few days, you keep taking a pill each day. You have sex at around the same time. Then when you stop having sex, you take a pill daily for the next 2 days. Then we go to the 2-7, the 2-7 dosing. So for the 2-7 dosing, this one now sometimes is needed by cisgender women and trans, even non-binary people having receptive vagina or frontal sex. Sometimes it is needed because what we do is this: you take two pills 2 to 24 hours before sexual intercourse, then one pill every day, 7 days, making a total of 9 pills. Because we are saying it is a 2-7 dosing. So you take two pills before sexual intercourse, then after the sexual intercourse, you take a pill each day for the next 7 days. Now, this is for situation where you did not take at least 4 doses of PrEP for the previous week. That is it. Maybe another thing is someone may say, okay, I forgot to take the first two, or I failed to take the first two pills before the sexual intercourse. But if I take it when I'm having the sex or immediately, it is okay. You can take it because what we say is that some PrEP is better than none. Some PrEP is better than none. But as we have said, it is safer between 2 to 24 hours. But where need be, where things are failed, you can take during sex or after, immediately after. But those are risks now that you're creating on your own. I think that is it. So that is what we should not confuse between the 2-1-1 pill and then the daily pill. Maybe I think that is all. I'm not adding anything.
Oh, why? Okay. You have explained well. Unless there are more other like points to note.
Maybe what I didn't tell you is who qualifies for the PrEP on demand, the 2-1-1 dosage. The people who qualify, number one, cisgender male who are participating in sexual intercourse with fellow male. People who are having, I'm a man having sex with a woman. I don't qualify for this. That is one thing that you need to note. If you are a man or a woman having sex with the opposite sex, you don't qualify for the 2-1-1. Man and woman having sex qualify for the daily pill regimen. Yes. Then someone who is HIV, someone who may require HIV prevention infrequently. They don't need it all the time. It's just once in a while. Yes. Then maybe someone who would benefit from flexible dosages as opposed to the daily medication. And the people who do not qualify for the 2-1-1 or the 2-7 daily, I mean the dose regimen. Number one, people who are having a hepatitis B infection. As I told you that you must first be screened. If you have a hepatitis B, you want to deal with the PrEP, get your medical doctor. All the fellow medics need to properly screen these clients. Then someone who is put in unpredictable situation that puts one at risk for HIV transmission. Such, for example, we have someone who fails to take the first two pills between 2 to 24 hours before sexual intercourse. He doesn't qualify for the 2-7. Doesn't. When you are saying people who share needles, sharps, then doctors who have got needle pricks, this doesn't work for them. This even based on demand pills, it's specifically for sexual intercourse. Prevents HIV only through sexual intercourse. Then things that we need to note is that this 211 dosing strategy has not been FDA approved, but has been studied with Truvada. Truvada is the current PrEP that we are using as our daily PrEP regimen. This COVID has not been studied. We should note that because in our previous video we talked about the new injectable drug that is being studied in Uganda and South Africa that is able to prevent HIV just by 2 injections in a year, and we saw that that study is being done hand in hand with this COVID, the new PrEP regimen in the building. Then this 211 regimen, its study has been done on men having sex with fellow men and it's effective on men having sex with fellow men, not me, a man, having sex with a woman. Uh, then the 211 can prevent HIV transmission during anal sexual intercourse. The reason why we say a man having sex with a woman should not try it is because number one is that uh, the component in the Truvada is not quickly absorbed in the vagina as compared to the anus or the rectum. So it easily reaches the rectum or the anus. That's why it can prevent HIV in the anal sex, but not the vaginal sexual intercourse. Then the PrEP, that is what I'm saying, that the PrEP medication absorbs so slowly into the vagina or the vaginal tissues than the anal or the rectal tissues. So it is not effective vaginal sexual intercourse. We should not try it. Because what are we saying? We are saying typically PrEP medication as we know it, if taken daily, it should be taken for a minimum of 7 days before sexual intercourse if it is to be fully effective for receptive anal sexual intercourse. But again, if it is for vaginal, it must be taken for 21 days for it to be effective for receptive vaginal sexual intercourse, or even other methods like the injection, the needle prick, that is for the daily PrEP. For it to be very effective, we must take it for 21 days. Then PrEP on demand only protects against HIV transmission through sexual contact. It does not protect against other methods like needle prick, body fluids. That is the PrEP on demand. It doesn't. So for those other methods like needle prick, the doctor has exposed, the worker has exposed, like the previous risks that we say, all those you need to be put on the daily pill or the long-acting injectable or a PrEP ring. That is it.
Okay, thank you. I think now we know the difference between PEP and PrEP. Thanks for teaching us.
No more questions.
No more questions.